Hi class, my name is Hannah Russell and this is my portfolio project reflection. At first I'm going to talk about our course outcomes and how the portfolio project addressed these outcomes. The first was analyze laws that apply to healthcare environment, articulate the rights and recourse of a healthcare professional as it applies to the legal process for lawsuit, examine the specific rights and responsibilities of healthcare professionals, analyze the liability issues for healthcare corporations, departments within a healthcare organization, as well as various occupations within the healthcare field to inform decision making. Examine the rights and responsibilities of a patient. Examine acts by a healthcare professional or organization that would be considered criminal. And all of these course outcomes were addressed in the portfolio project because we had to take an actual case and look at the legal implications and the wrongdoings and negligence of not only the physician or the nurses but also the hospital, and how the hospital has to take responsibility for their patients and for their physicians and employees also to make sure that their employees are getting the best care that they can. And then when it comes to program outcomes, we had to analyze and apply contemporary knowledge and skill sets to work effectively in a managerial capacity in health service settings, and utilize effective skills in financial planning, long-term care management, human resource development, public safety, and emergency planning, evaluate and apply leadership skills, and use legal and ethical principles to analyze and apply management practices of healthcare organizations and delivery of patient care. And then we had to research information management to evaluate and select technologies appropriate to particular healthcare settings. I feel that all of these have been met because this was more towards the end of our portfolio project when we had to reflect on the case that we looked at and then how that case would help us decide how we would do things differently if we were in a management position. And we also met those outcomes through all of our research for our portfolio project and how we had to find scholarly resources that applied to our writings and how we could back up the information that we were setting. And then when it comes to workplace capabilities, the first was communication that we had to discuss, and communication was very important for any portfolio project because you have to constantly communicate with your professor and make sure that you're on the right track for your project and make sure you're doing things correctly. And communication is going to be very important in any workplace because you have to make sure that you discuss things with your fellow employees and discuss things with your superiors, especially when you're questioning if you're doing something correctly, because you don't want to make a mistake and then have like legal implications after. And the second workplace capability that I chose was productivity, because it's hard to stay productive, especially when you have a crazy life and everything going on, especially during the holidays. And it's important to stay productive, and this is in any workplace. You have to stay productive so that you are doing things right and that you are seeing the patients that you need to see and that you're getting your work done. And the last workplace capability I chose was information literacy, and this was shown throughout the portfolio project when we had to not only read a case and understand it, but we also had to go out and find scholarly resources that applied to the case and backed up the facts that we were saying. And also this will help in any kind of situation in your future career because you have to make sure that you are backing up what you say, because you can't just say it because you think you're right. You have to actually have scholarly resources to back up everything that you're saying. Okay, thank you so much. This is my video reflection.